Chronic fatigue syndrome, also known as myalgic encephalomyelitis, has long been considered a debilitating, lifelong condition with no clear path to recovery. Many patients are told that there is no cure, and that the best approach is to manage symptoms with rest and avoidance of exertion. But what if this narrative isn't the whole story? A recent study challenges this idea and presents a new perspective, one that suggests recovery may be more possible than previously believed. This study, conducted by the Oslo Chronic Fatigue Consortium, explores the factors that contribute to persistent fatigue and how patients can regain their health. Rather than seeing chronic fatigue syndrome as a fixed, incurable disease, the researchers propose that the symptoms are driven by a combination of biological, psychological, and social factors. In many cases, these symptoms can become self-reinforcing. The body's stress response, combined with learned avoidance behaviors and fear of worsening symptoms, can keep people trapped in a cycle of fatigue. However, the study suggests that breaking this cycle can lead to significant improvement, even full recovery for some. One of the key insights from this research is that prolonged rest and social withdrawal may actually make symptoms worse. While rest is important during an acute illness, avoiding activity indefinitely can reinforce fatigue by reducing the body's ability to adapt to exertion. Instead, a gradual return to activity, when done carefully and with the right support, may help retrain the brain and body to tolerate exertion again. Let's look at an example. Imagine a patient named Daniel who developed chronic fatigue syndrome after a severe viral infection. At first, he tried to push through, but every time he exerted himself, he felt worse. Eventually, he avoided almost all physical and social activities, fearing they would make his symptoms unbearable. Over time, even small tasks like walking to the kitchen or talking on the phone felt overwhelming. However, when Daniel started working with a rehabilitation specialist, he learned that his symptoms were not necessarily signs of harm, but rather his body reacting to perceived threats. By gradually increasing his activity in a structured way, Daniel was able to rebuild his stamina and confidence. It wasn't easy, he had setbacks along the way, but by focusing on small, manageable steps, he slowly regained his ability to participate in life again. The study emphasizes that recovery is not just about physical endurance, but also about changing the way symptoms are perceived. Patients who viewed their symptoms as an unchangeable disease often remained stuck, while those who adopted a more flexible mindset, seeing their condition as something they could influence, tended to improve. Cognitive behavioral therapy, CBT, and other rehabilitation approaches have been shown to help patients reframe their experiences, reduce fear, and increase their ability to engage in daily activities. It's important to note that this does not mean chronic fatigue syndrome is all in the head. The symptoms are very real, and they stem from complex interactions between the nervous system, immune system, and behavioral patterns. But recognizing that these symptoms can be influenced and even improved through targeted rehabilitation strategies offers hope. The study also highlights the importance of including voices of recovered patients in the conversation. Many advocacy groups focus primarily on those who remain ill, which can unintentionally reinforce the belief that recovery is impossible. However, there are individuals who have recovered, and their experiences provide valuable insights into what works. These stories remind us that while chronic fatigue syndrome can be incredibly challenging, it does not have to mean a lifetime of suffering. If you or someone you know is struggling with chronic fatigue syndrome, consider seeking a rehabilitation program that takes this multidimensional approach. Recovery may not happen overnight, but by shifting the perspective from avoidance to gradual engagement, many people can reclaim their health and their lives.